Hi, you guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review videos, review courses, review books, and one on one sessions to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, my disclaimer reminder is we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have created and designed based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see, if I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into our questions for today. Question number one states a patient presents to the office today for follow up. The patient denies any complaints other than their legs and feet always are cold. Upon examination, the nurse practitioner confirms that the patient's extremities are cool to touch. She also notes that they are shiny in appearance and pale. Based on the presentation alone, what is the best diagnosis? Is it A, varicose veins, B, CBI, C, PAD, or D, DVT? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first so it allows you to slow down to ensure you're answering what is truly being asked here in the question, okay? So the stem here states, based on the presentation alone, what is the best diagnosis? Now, I always say if it's asking you about a diagnosis, you need to run it back and see what the assessment findings are. So this patient came in just for a follow up, denies any true complaints other than just stating their legs and feet are always cold. On exam, when the nurse practitioner is doing their assessment, she notes that the patient's extremities are cold and cool to touch. They're pale and shiny in appearance. So when you think of these, this is a classic presentation of PAD, peripheral artery disease, right? So your best answer is C, PAD. If you struggle with PAD and CVI, because there's so many similarities, go check out my PAD and CVI video to kind of help you retain this. But the Britney's brilliance that I like to say is PAD. I do like the Peace Up, A Town Down song. I try to remind you, yes, my craziness. But the peace sign looks like the letter V for Venus for CVI, right? And it points upward, right? Because veins bring blood to the heart. And then PAD, A Town Down, they do the letter A sign and it's pointing down, right? So arteries bring blood from the heart down to our extremities. So if we have peripheral artery disease, you're not getting adequate blood flow to the extremities, right? To your lower extremities. That's why it was cool to touch. That's why it's shiny in appearance. That's why the legs were pale in color, right? Because they're not getting enough blood flow. Okay. All right, question number two. A patient presents to the office for follow up to assess his INR. The patient has a history of a mechanical valve. He currently takes 5 milligrams daily of Coumadin. His INR today is 1.0. What are the next best steps by the nurse practitioner? Is it A, we want to decrease the Coumadin dose by 2.5 milligrams? B, nothing, this is a normal range. C, increase Coumadin dose by 2.5 milligrams. Or D, hold Coumadin and reassess. Take a moment and tell me what you got in the comments, you guys. All right, so similar question here states, what are the next best steps by the nurse practitioner? So what are we doing next? What is the next thing we need to do and what is best? These are words that you need to pay attention to in scenarios because it's going to be that initial thing that you need to do next. So what is priority and what is the best thing to do? So this patient came in, they're getting their INR assessed, has a mechanical valve, taking Coumadin daily 5 milligrams. INR today is 1.0. Now, one thing you need to know, mechanical valve, AFib, things of that nature, we're looking at a range between 2 and 3, right? For that INR, right? So this is below that range. So we need to increase the Coumadin, right? And for testing purposes, we increase by 2.5 milligrams, we decrease by 2.5 milligrams. Again, for testing purposes. I know that we do things differently in practice. You know my disclaimer, we treat on a patient by patient basis. And y'all know cardiology is my background. I know we do things different based on the patient. But for the exam, everything is a perfect world. So they want to know that you should increase by 2.5, decrease by 2.5, and knowing when to hold, etc. Right? And so when you get stuck, because I know sometimes it's like, wait a minute, which way do we go? But remember, Coumadin or your anticoags are blood thinners. So we give it to thin the blood, right? So the higher the number, the thinner the blood is. The lower the number, the thicker it is, right? So here we want you between 2 and 3. So we need it to get thinner. So we're going to give you more, right? So your best answer here is C, increase the Coumadin dose by 2.5 milligrams. And then question number 3. At what INR result should vitamin K be administered? Is it A, an INR of 7, B, an INR of 3, C, an INR of 5, D, an INR of 9? What do you think? When do we start to administer vitamin K? All right, so the stem of the question is the question, right? At what INR result should vitamin K be administered? Remembering that vitamin K is the antidote for Coumadin, right? So your best answer is D, INR of 9. Again, textbook, an INR of 9 is when we start to initiate vitamin K. All right? All right, you guys, I hope you found this helpful. As always, please be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But y'all make sure y'all meet me back here. If you have any questions that you would like covered, shoot us an email. If you need any of the resources that we offer, feel free to reach out to the nursing studio at 803 400 6864. You can also shoot a text message to this number or shoot us an email at thenursingstudio, the number 1 at gmail.com. A few things that I offer are the review book option. Either you can get the ebook or paperback option. They're both linked in the bio of this channel. The book is broken down by system. Each system has an interactive section. So you review it. It's short and sweet. So it's more so designed to be a quick study tool. So something just to kind of give you the quick points of the assessment, diagnosis, evaluation, and treatment on each diagnosis. And then it has the interactive section to gauge. It's just a simple fill in the blank to test your knowledge on that area. And then there are images associated throughout the book for different things, charts to kind of help you break it down, and then also practice questions with rationales in the back. Now, the self-paced independent review, if you're just looking for something to listen to audio or watch the videos while reviewing for family or adult Gero independently, that's also linked in the bio of this channel. There are mini quizzes associated with each system. And then lastly, the one-on-one sessions. I break one-on-one sessions down into either you can book sessions for 1 to 2 weaknesses at a time during our sessions to cover. So if there's a particular area that you're struggling, you can book a session and say, hey, I just want to book to get this area under control. And then we will work through those areas. You can book for an exam readiness assessment. Or lastly, you can book the custom package. The custom package is you're provided with a pretest. I gauge your weaknesses. And based on the duration that you're wanting to allot to studying before you're testing on your exam, I structure a study plan for you for that period of time, work alongside with you during that time to get you to a successful test date, okay? So if you need any of those resources, feel free to reach out to us at the nursing studio, but y'all make sure to meet me back here. Happy studying. Bye, y'all.